Good day, everyone. RIchard Copwerthwait for Northwest Access TV. Thanks for joining us. Happy to have a guest for the first time on our airwaves, Paul Dragon, the Executive Director of the Champlain Valley Office of Economic Opportunity, pretty well known as CVOEO. Paul, really appreciate the time. I have some sense about, I can't imagine how busy you are dealing with all the stuff you're dealing with, but good to see you out here.
It's a pleasure to be here. Thanks for having me.
Yeah, I should note that I met Paul not too long ago at the, oh boy, am I forgetting In Their Shoes.
Yeah.
Good, I can't even remember. The In Their Shoes walk that was a decent turnout a few weeks ago in St. Albans. Good turnout, decent day for it, but again, visiting some of the agencies you're dealing with, some of the social service agencies, which seem to be having maybe an ever more important role these days.
That's right, yeah.
Anyway, give us a little background on yourself, Paul.
Personally or the organization?
Probably a little personal, but most, how long have you been exec director?
Yeah. I've been with CVOEO for 4 years now. Before that, I had a career in state government. I worked for the state for about 15 years. I was Deputy Secretary of the Agency of Human Services at one point.
Wow.
And I've done a lot of social services all the way back to my days as a Peace Corps volunteer in West Africa.
Wow.
So I've been with CVOEO now for 4 years. It's a great organization.
Yeah.
The team there is just amazing, doing amazing work.
Wow. Boy, it sounds like you have a lot of things going. In fact, I guess one recent change, I just noted that Feeding Chittenden has just turned into Feeding Champlain Valley.
Yes. So Feeding Chittenden has, over the past decades, been the largest direct food service site in the state of Vermont, and we work closely with the food bank, obviously. We wanted to leverage that capacity, that efficiency, and really work not just in Chittenden County, but throughout the Champlain Valley. So that's Addison, Chittenden, Franklin, and Grand Isle. We have developed food hubs in different areas. We have one in Colchester. We have one in Middlebury. We now have one in Sheldon and Franklin County.
I noted that. So you have Sheldon too.
Yeah, and we have, a great food shelf at Northwest Family Foods, and we have a great food shelf down in Addison at our Middlebury office. So Feeding Champlain Valley is really a food access network between our 3 different food shelves, and Feeding Chittenden is really the catalyst for that.
Interesting. Again, the need, it just seems like for a lot of your services, maybe all of them, the need keeps getting bigger for this, growing, or that depend on the agency kind of?
Well, the need is huge. Just to keep with food for a moment, I mean, any of us have gone to the grocery store, we've seen the high cost of groceries, right? Inflation is pretty high. And food insecurity in Vermont is really high. 4 out of 10 Vermonters are food insecure.
I guess I've heard that said, 4 out of 10.
Yeah, a lot of children, and what we're trying to do really is make it easier for them to get food to them. And it's not just any ordinary food, right? We want people to get the food that they want, so we eliminate food waste. There's a lot of stigma, too, there can be, with going into a traditional food shelf. So what we're trying to do is get food out to where people are at as best we can. So this is really important for rural areas like Addison and Franklin and Grand Isle counties, and we want to get them the food that they want. So if they have a medical need, we have a food as medicine program. Diabetes, hypertension, cardiovascular, can work with their doctor to get them the kind of food that will be better for their health condition. If they're a new American coming into the country or a migrant farm worker, we want to get them the food that they're used to. So the whole idea here is access, availability, and make it easier to get the food so people are more food secure.
And your sources for food, excuse my voice, obviously you get some donations. Some of the supermarkets pitch in for this? Or?
Yeah, so we work really closely with the Vermont Food Bank, first of all. We get a lot of our food through that. We get a lot of our food through the federal program. It's the Emergency Food Assistance Program. And then we get a lot of donations, and we get a lot here, particularly from Hannaford's, does a great job giving us food. And then we also glean from some of the farms, so we also work with farmers in the different areas to, make sure that we're getting fresh produce to people who need it.
Wow. And that 4 out of 10 statistic of folks who are food insecure, there's quite a bit of variable in the 4 people out of 10 that are food insecure. I mean, some folks obviously are maybe perhaps just barely hanging in there, others not in nearly that bad shape?
I think you're right, Richard. The data is never great because people don't typically come forward and
Sure.
say, it's one of those things that people are most embarrassed about more than anything, and
Yeah.
not being able to provide for themselves food. So it is an estimate, but we do know there are a lot of children within those 4 and 10 who are only getting food maybe at the schools. And summertime, as you know, is difficult for kids because they're out of school. So we want to make sure we have a huge Head Start program. All 4 counties, we have Head Start classrooms. So we're delivering boxes of food to the Head Start families. And Head Start families are typically the lowest income, 130% of the poverty level. So that feels good to be able to get them food.
Did Head Start, I asked one of my friends in Fairfield the other day, a nice music event in East Fairfield, did Head Start start around here, or am I dreaming? Seems like there was some program that started. I'm even thinking Fairfield or East Fairfield, or am I dreaming? Nothing comes to mind. And I maybe had the wrong program, but it seems like it was some noteworthy program.
Yeah, just a couple things. So Head Start started here in 1965 as a program of CVOEO. And actually, we were incorporated in St. Albans, even though our main office is in Burlington.
Yeah.
And we have 11 different programs. Head Start is one of them. And we've always had classrooms here. So we just recently, 2 years ago, refurbished the Barlow Street building, that big old, used to be
know it well. I play tennis
there you go.
next door once in a while.
We have early Head Start and Head Start classrooms just flourishing there right now.
Wow, interesting. And a little background, CVOEO has been, you said, goes back to 1965?
Yes.
In Vermont?
Yeah, we're one of the older community action organizations in the country.
Really?
There's 1,000 community action organizations in the country.
Wow.
Community action started as part of the 1964 Lyndon Johnson's War on Poverty.
Wow.
It's called the Economic Opportunity Act.
Okay.
A lot of great programs came out of that act, some of the greatest social innovation programs ever in United States history.
Wow.
Community Action, Head Start, Job Corps, Peace Corps, Vista, and CVOEO. Every state has to have a state office for their community action. And we were the first state in Vermont to have an office. It used to be in the governor's office. And CVOEO was the first community action agency in the state. So we think we're one of the older community action agencies in the country, actually.
Interesting. And again, you've touched on this. CVOEO serves 4 counties, Franklin, Grand Isle, Chittenden, and Addison. In fact, do you go beyond that?
And more, yeah. We have
Those are your 4 kind of core counties?
Exactly. You get a designation based on population and poverty levels. We're designated for those 4 counties. We also have many statewide programs. We have our mobile home program, which serves all around the state, Fair Housing, Vermont Tenants, and we have a home voucher program for families with children who are experiencing homelessness. We administer that statewide. And we have an Office of Racial Equity and Community Inclusion that does statewide work as well.
Well, statistics catch my eye at times. I've got your annual report here for, I guess, last year, 2023, and individuals served statewide over, 21,000. In Franklin County, almost 4,700, which Franklin County population is right around 50,000. So just from that number, almost 10% of the county's population.
Yeah, and we know we need to do more as well, right? So that's why we're always trying to amplify our work and trying to get the word out and do as much as we possibly can and expand where we can. We're hoping at some point to maybe connect with partners in Grand Isle and have a food hub out there like we do in Sheldon or Colchester.
Interesting. Of course, there are some folks, boy, the partisan political situation in Vermont seems to have gotten a lot rougher lately. The governor really kind of verbally slugging it out with the Democratic supermajority. In fact, I just read today, I think Vermont Digger had it, an opinion column, and I don't know this state rep, but I believe I have it right, Angela. Am I spacing? Did you happen to see the...
I didn't see this one, I'm sorry.
Angela Arsenault, I think I've got it right now, the Democratic rep from Williston, but she was not happy with the governor, who had some pretty harsh words for the Demo supermajority, and she kind of responded a bit in kind, but she also said that, I'm not sure, she said she was getting death threats, but made a reference to some of the legislators getting even death threats. I guess this goes back to maybe some of the vetoes and just the, boy. And again, you've been a state government veteran in the past.
Yeah.
Are you struck by, I mean, Vermont's, I think, pretty well known for a pretty civil political discourse. Are you concerned about that? Do you see that much different now than in your state government years?
I think the discourse has become more polarized for sure, nationally and in Vermont to a degree. I do think overall we have a very respectful state and communities that tend to embrace each other. I think, the governor tries to do the right thing, the legislators try to do the right thing. We just all have different perceptions of what that right thing is. But at the community level, I see all people, for the most part, coming together to really try to figure out how to best help their neighbors, whether it's coaching Little League or volunteering at the fire department or, donating food and clothes. I think those things cross political parties, so that's so gratifying to see.
Yeah, well, it sounds like compared to the national political scene, Vermont's not in too tough shape, but I'm just struck. It just sounds like it's gotten to be a bit of a tougher situation. Of course, Franklin County, I almost feel like I'm in the alternative universe up here with the Republican Party in such tough shape, aside from having a still very popular Republican governor. But aside from that, Republican Party in pretty tough shape in Vermont. Without Franklin County, I give you a 13-member legislative delegation here with all of one Democrat, 12 Republican, Mike McCarthy, Democrat from St. Albans City, who happens to be my state rep, the only Democrat in the delegation. And it sounds like the Republicans, with just a huge concern about property tax, the yield bill, of course, the governor's veto of that was overridden. I'm sure if I'm hearing this, you're hearing this all the time, just affordability issues but it just sounds to me like there are a lot of borderline crises out there. Am I exaggerating that too much? And you're on the front lines of a lot of this stuff.
No, I think you're right. Some of these issues like homelessness.
Homelessness comes right to mind. Housing.
These are deeply systemic issues that St. Albans or Franklin County aren't going to handle on their own. In fact, the state isn't even going to handle on its own. They're so systemic. We need the federal government to also embrace these deep issues of poverty, especially in a country with so much wealth. I think we can have affordability, and I also think we can make choices to make sure that the people who need it the most get what they need. Nobody should go unsheltered. Nobody should go without food. All the data that we have suggests that most of the people experiencing homelessness, many of them have a disability. Up to 80% have some type of disability. And we're seeing higher rates of people 55 and older who are homeless. And that's disturbing. We want to take care of our older Vermonters and people with disabilities.
Wow. Well, sounds like a lot of issues. Again, after the walk within their shoes, when I met you, sent you a few bucks, you signed the letter. Nice of you, I'm sure. Anyway, but the reference in the letter that I got last year, 462 people experienced homelessness in Franklin and Grand Isle counties. So almost 5. That's a pretty solid stat. You guys do a pretty good job with these stats, presumably.
Yeah, I think it's a low number because what we do is we take data from the point in time count, which is one night out of the year where we all go out and make a count. And as we know, that's just a slice of what happens throughout the whole year. So it is a low number. It also doesn't count people who are doubled up. So HUD has a definition of homelessness, and it's people living in a place not meant for human habitation or in a shelter or on the street. But the Department of Education, the federal department, says that homelessness also includes people who are doubled up, who don't have any other place to stay, so they might be doubled up and living. So if you look at that definition, we have a higher rate, and plus it is only one night out of the year. So it's a low number, but it's accurate. I mean, it's better to go in not trying to inflate things, right?
But easy, again, 462, so easy to think that might be closer to 500-600 or something.
I think that's a good estimate.
Strikes me that's a lot of people.
Yeah.
And that would be, again, obviously you hear folks living outside. That would also include people living in their cars, I assume? Or?
Yeah, we get sometimes, many families living out of cars,
Wow.
and people living out of cars, and people living in tents, obviously, as you know. So, yeah, it's very difficult.
Well, you mentioned off air, I happened to go to the St. Albans, so crime's an issue probably everywhere, but it's seems like a bigger issue in St. Albans in recent times, and there was a very well-attended meeting at City Hall recently with about, I think, 300 people showing up, so a lot of concern there, and homelessness issues certainly came up, some folks voicing concern about seeing some homeless up in the Aldous Hill, Hardack area, reference to the tent city, which I can't say I was real familiar with. I guess they took that down, that's gone. Boy, homelessness, again, it just sounds like such an intractable issue. I know I interviewed the legislative candidates before the November 22 election, and one of my questions was, should this be a state responsibility to deal with homeless, unhoused people in whatever manner you decide to? And I was kind of getting murky answers, but boy, it just sounds like a really tough issue, especially with housing costs. I mean, a lot of communities in St. Albans is just starting a reappraisal. Just keep hearing assessed values of houses or not the assessed value, but the fair market value has doubled in a lot of cases. Boy, some of these issues just seem pretty overwhelming to me. But you don't strike me as someone who gets overwhelmed by stuff, and credit to you for that, but these sound like really tough issues.
They are deeply troubling and deeply systemic, and they will take a multifaceted response. It has to be the federal government. It has to be the state. It can't be just Burlington. It can't be just St. Albans.
Really?
We don't have county government. That can make it a little bit more difficult as well. But no municipality, no nonprofit can deal with this on their own. We need the state to be an anchor and a resource and a solid ground for this work to happen. And we need the federal government to step in and say, here is our national policy to house people and keep them sheltered, because a nonprofit or St. Albans isn't going to change the system. The state and the federal government really have to help do that.
Do you see the federal government, do you see any optimism coming out of the federal government, doing more to deal with issues like this?
I don't think the federal government has done a good job at this, quite frankly. The current administration has a plan around homelessness that has not been widely spread out or communicated. I don't hear congressmen and senators and congresswomen really speaking about homelessness, which as much as they should, which is a little disconcerting, considering that our rates of homelessness in this country are some of the highest they've been in our history, and we know that Vermont is second highest.
Second highest per capita to California?
That's correct.
Wow.
Yeah.
In fact, that makes me think of State Auditor Doug Hoffer, who isn't not the most popular guy with St. Albans City officials. St. Albans City's done very well with its tax increment financing, its TIF districts, which the state auditor doesn't seem to be too high on. But didn't he question at one point just all the money Vermont was putting into homeless issues, and question how effective that was? Did he get into that issue a bit at some point?
I mean, other than just hearing about it, but I think that response was to some criticism around the hotel program.
Okay.
And what the rates were for some of the hotels. There was a high variability of what they were asking and getting. Sometimes, $165, $200 a night for a person. And so that's not sustainable, and I understand. I think the hotel program on the whole has served us well in that if you don't have places for people to be or enough shelter capacity, then you are going to have places like Tent City. And where are people supposed to go? If they're moved from one place to another, there's no solution. They don't find a solution. So I think the hotels were, on the whole, successful. At the beginning of the pandemic, we still had one of the highest rates of homelessness in the country, but we had sheltered 98% of the people, which was the highest sheltering rate. So we've lost that thread quite a bit by diminishing the hotel program. So I think there can be a balance here where we're paying the proper rates, we're attending to and nurturing some of the hotels are working within the program. But I know we're diminishing the hotel program in July and then again in September. So we're going to see unsheltered, the numbers exasperated going into the winter next year, and that does concern me.
I bet. And obviously, a number of those people, the unhoused, homeless people, are coming in and taking advantage of food shelves and stuff like that, I guess, I would think, obviously.
Yeah, there's so many needs there. I mean, we see, just as an example, in Burlington at our Community Resource Center, we can see up to 180 people a day, and many come in with wounds, many come in with chronic health conditions, many in wheelchairs, a lot of older people, 28% now over the age of 55. So I think people need to understand that the people that we're seeing that are unhoused and unsheltered, or just homeless living in shelter, many of them have disabilities, intellectual, developmental, mental health. They're aging, they're older Vermonters, and it's our responsibility, I think, as a community, as a state, to take care of them.
Again, 4 years for you as exec director of CVOEO.
That's right.
Has just all the issues we're talking about in general, are these issues getting tougher or more significant in your 4 years?
They've been getting more significant. In spite of us taking on, we added the Samaritan House to our work 2 years ago for community. It was a need that somebody take on that shelter. We brought on the Champlain Inn shelter, a very large shelter in Burlington, because the former organization could no longer sustain it. I think the thread here is that the shelters and these services are hard to maintain as an organization when the funding does not necessarily keep pace with the need. So it takes an organization that maybe has some, backup like CVOEO to take on some of this. But even with doing all that work, we're finding that homelessness has been growing. So that tells me that there needs to be some kind of restructuring in the way we do our work in our society, both at the state and the federal level, to make it easier for working people and people who are experiencing homelessness, for working people to stay in their homes, because a lot of people that we see, some are in the shelters, are still working, or they were working and they couldn't work anymore because they can't afford transportation or a place to live.
Right, lack of transportation, of course, Vermont's not exactly overwhelmed with a lot of public transportation in a place like Franklin County.
That's right, and I think one way to think about this, it's not just like this human service or charity, it's a community development issue. If you get people stabilized, get them in shelter, they're more likely to be economically independent. The way CVOEO operates, we have 11 programs. I mean, we have some emergent work, right, for shelter, for food, and we provide a lot of warmth. We repair heaters, we provide fuel, but the bulk of our work is really around economic independence. That's our goal, to move people into the economy so they can be integrated part of the community and give back. And I'm seeing a lot more work, and our focus is on the emergency stuff right now.
Of course, another huge issue statewide, probably everywhere, just labor shortage. It sounds like everybody's looking for more help these days. Incredible staffing issues.
Yep, that's true.
So ideally, some of the folks you're dealing with who haven't had jobs, hopefully, or some of them are getting some of these jobs. There certainly seem like there are plenty of jobs out there for what that's worth. I guess worth something in some cases.
We do see some successes. But if people are living outside in a tent, it's going to be really hard for them to pull everything together. And there are probably issues that got them to that point. So our whole goal is, like at the Samaritan House, we moved from mass congregate shelter to single rooms so people can have their own space, recuperate more quickly, and then get ready for work in the morning and, do the things that they need to do without being stressed out with a lot of other people around them that, are have trauma themselves from being homeless. And so you can't pack people into these small rooms and expect great things. That's why everybody's got their own little apartment now at Samaritan House, and we're doing the same thing, or trying to do the same thing at the Champlain place.
Yeah, that's right. Yeah, I know Ben Kaufman, your Samaritan House guy, sounds like
Yeah.
doing a fine job. But no, it sounds like that's been, a good way to go. And
Yeah.
so some of those folks obviously could deal with the job, obviously way easier than someone living out in a tent or something.
That's right, exactly. Yeah, you get
Right.
more stable. You can shower in the morning, wash your clothes, maybe get some transportation to where you need to go.
Yeah.
It does become much easier.
Public transportation, again, not a huge thing in Vermont. Not looking like that's changing anytime.
It's a real, I think, weakness, and
Yeah.
it's
even Burlington area. Again, I'm not in Burlington. Even Burlington area is not the best, obviously.
It's got the bus system. It
Buses.
was for free. They're starting to charge
Starting
again.
to charge again.
And
yeah.
in rural areas, I think this transportation issue is a big deal.
Yeah.
And I don't have solutions. I know when people start things up and there's only one or two people, it doesn't become economically viable.
Yeah.
But I do think we need to think more carefully about how to provide transportation to increase the workforce. And that might be subsidizing transportation, and making it more widespread and putting our effort into that. Because again, I think the bang for the buck is you provide this transportation, you get people in the workforce, they pay taxes, it goes back into the economy.
Yeah. So it's a lot of issues, but on the on our walk with the In Their Shoes, I thought that was very helpful for me to see just some of the programs you have going on. In fact, I interviewed at Lori's house.
Yeah.
Interviewed Chris Lukens, who's been involved in that for decades. Interviewed Chris and her successor as exec director, Shannon McMahon.
Yeah.
And it's on 24 hours. You can every second of the year you can call up on a hotline if you have issues. Are there other, you might have touched on this, are there other newer programs you'd like to add, Paul, to CVOEO, what you're doing now?
Well, to connect both those things, Voices Against Violence and Lori's House, we have a huge waiting list, and you never want a waiting list for survivors because they could be staying in unsafe situations. We have a 50-person waiting list at the Samaritan House, by the way.
Is that right, 50%?
Yeah, so this is a big deal.
And people can stay, I'm sure this was mentioned on the In Their Shoes walk, people can stay there not forever, but for some months, for a good while.
So, we try to say, 9 months is the limit, but if people are working towards their goals, we're going to let them stay rather than put them out, because honestly, our length of stay in the shelter, they used to be like 3 months, is the maximum. It was. And now, because of the lack of housing, it doesn't seem practical, and you don't want to put people back out. So the way we do it is, this is your room for however long you need it, as long as you are working towards economic independence in your own place. And so to your second point, for us to take on more is always difficult because we've taken on so much, but we are looking at expanding our shelter capacity, transitional housing for survivors of domestic violence because of the long wait list there. We're also looking at the possibility of a winter shelter here in St. Albans because of the need. And I know both those things will be difficult. They'll be difficult for the community. They'll be a difficult conversation. And, I guess for me, it's like the people are here. We are here at CVOEO, not just for those people, but for the whole community. And when we provide services, we don't think just about the people that we're serving. We think about how can we stabilize and knit together the community as best we can. So we're here for everybody. And these services don't attract people. The people are already here. And we see that evidence because camps have been removed.
Did you get there, or did you know Tent City, again, I'm hardly on top of some of this stuff, did you know that Tent City, that they were going to take that down?
Yes.
Do you know what happened to the people, how many people were there, roughly, do you know?
I don't want to say because I think it varied, but I think it's around 20 or so.
Do you know what happened to those 20
Our
or so
staff reached out and tried to get them placed, but I suspect there weren't hotel rooms available.
Yeah.
So we also provided transportation if people need it, but there's not really many hotel rooms around the state. So a few of them got in hotel rooms, and many of them may have found places, social connections, maybe not the best places for them to be because they would have been there already. And then some just move and are camping in different places.
Boy, and the state just seems to be the old kind of kicking the can down the road. They, just add some more months, but there certainly doesn't seem like any long-range game plan here. Am I missing something?
No,
there?
you're spot on.
And I don't mean to say it's easy to come up with such a long-range game plan.
No, for sure. I mean, that's, it's hard for the state to do things on its own without more federal support, and we do need that. That being said, the state put out $10 million for a request for proposal. It's just for this winter. It's one-time funding, and it's really hard for organizations like CVOEO to set something up for 5 months. How do you hire people for that short a period of time? Who wants to do that? It's really difficult work. Then you've got to sign leases, get insurance, do the technology, try to hire people. These are very difficult endeavors. So I don't know how many organizations will take them up on that. And it's only 1 year funding, which makes it difficult. So to your point, there is no long-term plan. We used to have a roadmap to end homelessness that goes back to 2015, and we veered from really following what that would look like, and now we're way behind the 8 ball on much of the work that was outlined in that roadmap. And we've got to get back and be strategic and invest, and there's no way around this. Then you've got to be able to find the money to invest in the shelters and in the programs that are going to help people. And in the end, that's going to help the community. It's going to help the upper class, the middle class, the lower class. It's going to help our workforce issue.
Oh, I guess you touched on that. In your state government years, it just seems like homeless. I mean, I guess I heard about it. I've been reporting around here forever, but I guess I would hear about it, but it just seemed like it wasn't an issue getting much attention, or not nearly the attention it's getting these days, but state government, it's not like this issue came out of nowhere a few years ago, obviously.
Vermont was lauded as one of the best places in the country. We had the second lowest percentage of homelessness in 2016.
Is that in 20?
That's just 8 years ago.
Really?
So
what begs the question, so what the heck happened?
Well, I think we lost our focus. We didn't follow the roadmap. COVID did happen. Inflation certainly happened. A housing crunch happened. A lot of things all came together at the wrong time. But we need to reset and get back to 2016. What it tells me is it's possible. That was just 8 years ago. It is possible to get back and do the innovative work that we need to do. We shouldn't have just nonprofits like CVOEO running shelters and caring for people with severe and persistent mental illness. We should have our mental health organizations around the state who get Medicaid reimbursement, and our healthcare organizations who get Medicaid reimbursement doing more around shelters. Because we have staff in there who are dealing with people with paranoid schizophrenia or people who are in their 80s, and they're helping them, change their diapers. This isn't work for people in a nonprofit who are hired to work at a shelter to move people to economic independence. This is work for people who have access to psychiatry, clinical social work, medication management, and have knowledge of chronic medical conditions. A lot of the people in our shelters now are way out of our field, and we need other nonprofits, the mental health field, the addiction field, the medical field, to come in and say, we got your back, we can do some of this work.
So it sounds like you obviously feel state government should be just doing a lot more, federal government and every...
State government, federal government, and I think for, our nonprofit world, we coordinate really, really well together. We do a lot of work. I would like to see some of the mental health agencies and medical entities start investing into shelter for people with compromised mental health and medical
Well,
conditions.
more shelters sounds like that's pretty kind of at the top of the list. Maybe there are a lot of things at the top of the list, but that sounds like that's right up there.
Housing First is like the top of the list,
Yeah.
but we don't have the capacity and we won't get there. In the
Yeah.
meantime, people are living on the streets
Yeah.
or in unsafe situations, and we do need shelters that are really responsive, that are trauma-informed, and that can work to get people economically independent and help move them forward, not just stockpile them. And it is like the right level of care. If something happens to most people with a middle-class income, we'd have access to nursing homes or a community care home. We don't have those kind of facilities for people experiencing homelessness, so there's a discrepancy there.
Boy, you might have touched on this. For the homeless population, unhoused population, roughly a significant percentage have some kind of mental health issues. Is that a statistic?
The data from our coordinated entry in Chittenden County shows that 80% of the people have a disability. Some type of disability.
80%.
It could be an intellectual disability, developmental disability, a mental health condition, or an addiction issue.
Wow.
Yeah, or a medical some chronic medical condition.
Wow. Funding, boy, it sounds like funding. I guess maybe talk a little about funding. It sounds like, I know you love to get donations, but variety of funding sources, and is that, I can only assume that's always an issue. I'm sure something
We're like
you
a
deal with
hamster on a wheel every year trying to put this together.
Wow.
We do get some stable state funding, and then other things are one-time funding. So again, you hire up, you try to do the work, and then it's over, or you try to keep the program going through donations. So we've tried to strengthen our philanthropy and communication team because we know we can't solely rely on federal and state dollars anymore, so we've got to rely on the community. We write a lot of grants. We're always patching things together. It's always like, it's almost nauseating because you don't want to let people go, you don't want to let the community down, and you're trying so hard to put funding together to keep your staff going to be able to have these programs exist.
Yeah, sounds like a huge, another very tough issue. At times, if staffing, if you're just short on funding, do you have to scale down some programs? I mean, does that happen at times?
Yeah, we haven't. We almost had to in this upcoming year, but we were able to secure some funding for our outreach program. So since I've been here, we have not had to scale anything down, luckily. But again, it's with constant effort and work, and really a lot of support from our community as well.
Boy. Are you in a fiscal year? Is your fiscal year about to end, or are you calendar year?
Yeah, so community action agencies, they get a little bit of federal.
Hooked into the federal.
Yeah, we're on the October 1st through September
October
30th.
1st.
But we also are very attentive to the state fiscal year, which ends in June and starts in July. Yeah.
Boy, so funding, is that a good hunk? I'm sure that's some of your job. Is that a significant hunk of your job? It sounds like.
Yeah, we get about 60% federal, 20%, 25% state, and then the rest through grants, foundations, donations. And we're trying to increase that because so much of our state dollars in particular are either one-time funding or static. We don't get a boost. Every year, cost of living goes up. You've got to be able to provide that to your staff. But the federal government doesn't give you a cost of living increase. Our fair housing program since 1985 has got the same amount of money.
Really?
So how do you do that as an organization when your costs go up and when your salaries go up for a cost of living? So we have to get donations.
Boy, housing, I think I've seen the stat, I'm sure you would know this, of the state ideally could use another, 45 or 50,000 housing units or something? I mean,
Yeah.
Sounds like St. Albans City's done a pretty good job.
Yeah.
And they've got, of course, about a 70-unit project going up on Lake Street now, but I'm sure, but affordable housing, of course, that term has always kind of thrown me off, and that's maybe especially these days. But Have you got some, the legislature certainly has been struggling with that issue, certainly also.
Yep.
Have you got some hope that that issue may start working out better, or not a lot of hope? Or
Yeah, I think so. I think we have really innovative housing leaders like the Vermont Housing and Conservation Board. We have local partners like the Champlain Housing Trust.
Boy, an old friend of mine, in fact, I'll mention Brenda Torpy's an old friend of mine who started her Vermont career here in Franklin County.
Wonderful.
Done a tremendous job.
Yeah, just a tremendous job, and they're a great organization. And I think there's a lot of legislators who know, right, what are the barriers we need to get over to build more housing? And none of us wants it out in these rural areas, really. We want it, more in the towns and in the cities. So I think we have like a true north there. We didn't get everything we needed for housing, obviously, but again, if we can create that 5 to 10 year strategic plan and keep to it, stick to it, because that housing stock was referenced in the roadmap in 2016, what we needed to build out, and we just haven't been able to do it.
Well, the issue is obviously getting a ton of attention now. You think that hopefully will help, but it's certainly an issue getting a lot of attention. Paul, down to about 3 minutes left. Any other stuff you want to? You've covered a lot of ground, which I appreciate. Other things you want to give some publicity to?
I just want to reinforce that the programs that we have at CVOEO, I think people look at them and say, they are just for low-income people.
Yeah.
That is true to a degree. I want people to understand we are here for the whole community, first and foremost. And the work that we do is here to create the infrastructure and the stability and the connection and the relationship so we can all thrive together and that nobody is left out. And that's how we succeed, when we all walk together as a community.
I think CVOEO, I guess, I've certainly been familiar with it a bit around here for forever. It seems to be a pretty well-regarded organization. Do you get that sense in your old state government days?
Yeah, always, there's a roller coaster to some organizations. This one, I think, has always adhered to its mission, always has been attentive to the community needs, has always leaned into the challenges, and has been a really strong organization. And we get monitored a lot. We get audited, monitored, and
by the feds, state, everybody?
By the feds, by the state. We have 58 organizational standards that we get monitored on. We got 100% the last 3 years. So we do everything we need to do to make sure we are an organization with a lot of integrity.
And how are you doing staffing? We mentioned just a labor shortage. I mean, has that been tough for you when you're looking for people and not finding the people you need? Yeah,
it's picked up lately. Our weatherization program was running at a deficit. We've recently hired a couple people. Our Head Start program we needed 10 hires, and now we're fully hired up. But we still have about 20 vacancies. Not as bad as some organizations. And we have about 250 openings, 250 people.
Who work for?
Yeah, it's at 230 right now, but we need another 20, so we do have some openings.
Folks thinking about a job,
Great benefits, good pay, really wonderful team with a spirit and a mission.
Right. Again, I'm just struck by all the stuff you're doing, but you yourself are hanging in there. You're doing okay as exec director. Any game plan? Is this a job you'd like to have for a good while, or who knows?
I'm honored to be here. We have a great board and a great team, and I'll be around for a little bit. I think every organization needs a little change at the top periodically, and nobody should hang on too long.
Anyway, well, I'd like to think they'll hang on to you for a while longer. But Paul Dragon, thank you very much for the time.
Richard.
Paul Dragon, the Executive Director of the Champlain Valley Organization, or Office of Economic Opportunity, CVOEO. Thanks a lot. And thanks to my producer, Josh Pryor. We appreciate you watching us here on Northwest Access TV. I'm Richard Copwerthwait. See you next time.